Yang.
Hello, nerds!
Hello, nerds!
Hello, nerds!
Hello, nerds! So nerds!
Hello, nerds!
Now with this campaign, bang, dang, it's and Drew, come roll with the Yang Gang.
Hello, nerds! Nerds for Yang. I just finished a conversation with Kristen from the Long Island Yang Gang and a longtime supporter of the Nerds for Humanity channel. But this one is a live stream all about Corona or COVID-19, or as the president likes to call it, the Chinese virus. So let's get into some data. I know you guys are all interested in it, and I am super excited because the failing New York Times, as the president likes to call them, has come up with some freaking mind-blowing data visualization. And when I saw it, I was like, oh shoot, we're gonna have to do a unscheduled live stream and go over this stuff. So let's get it going, and then I'm gonna wrap up because I'm a little bit, just a tiny bit under the weather. Not to worry, because I have a runny nose, and my understanding is that that is not a symptom of COVID-19. So I think I just have a normal flu, unless, of course, the virus has mutated, but let's hope that's not the case. Okay, before we get going, where are folks joining us from? New Jersey. You know, I used to live in Bergen County not too long ago. So welcome, Kevin from New Jersey. And before we get started, I also want to thank some of the members of the channel. So I'm just going to quickly give them a shout. Do that enough. And those members are becoming super important because now I'm starting to promote the channel with some paid advertising, which I couldn't do when we were officially supporting the Yang 2020 campaign because of the sort of restrictions on advertising for political campaigns. But now that we're just a YouTube channel talking about current events, I can advertise. And so all that member money will be going towards that. It used to go towards the Spanish stuff, the Spanish audio dubbing, which we're still doing some of, but most of it will now be shifted towards promoting the channel, growing an audience so we can get more people to spend time with us and have these kind of in-depth conversations. So let me just say thank you to a few of our members before we start looking at the data. So let's see here. So at the executive vice president level, which is the highest level, we have Kristen Slevin, who is just on the show. She's been a member for 2 months, so thank you, Kristen. And then at the next level up, we have our vice presidents, and those are Chris Chan, who was actually just in the last live stream. He's a fairly new member, just a week ago. And then you have Fat, JM Sap, VLAM, and Locke. Fat, JM Sap, V, and Locke have been members for 2 months, so thank you for that. And then hardcore, we have Ming, Mike, Chad, Felix, L, Bogart, Gene, Adrian, David, Tracy, DK, Landline, Amanda. Amanda and Landline are our newest hardcore members. And lastly, our verified members. We have Sydney, who I think was our first member ever. So I always like seeing Sydney on this list because I'm glad you haven't canceled your membership after Yang suspended his campaign. But we also have TY, John, Lisa, Brian, Sugar Sweet, Yes Ramirez, Luang, Don, Brandon, Albert, Perez, Peter, Knight, Sophie, Your Momin, Hitachi, James Johnson, Gail, Machado, Jadwiga, Basecki, Carlos, Torriello, Sophia Chen, Mick CK, Shake and Make, Albert Chang, Doris Emmerich, Verily Gray, Miles Patton, Mercy Ann Andes. Oh, Mercy Ann and Miles just joined recently. So thank you to you guys for supporting this channel. You are helping us invest in our podcast hosting fees. You can now find our best interviews on most podcasts, wherever you find your podcasts. And then you're going to be helping sponsor the growth of this channel through some advertising. And now we're going to say hello to where people are from. Landline from Colorado member. Thank you, Landline. Maryland from the Hudson. Is that from? We've got LA, Canada, Seattle, Go Hawks, Mass. I wonder, are you happy that you're getting Cam Newton? I don't know about Cam personally, but he definitely knows how to dress very interestingly for his press conferences. Florida, Arkansas, small town Colorado. What does verified mean? It's just one of the levels of being a member. I think verified is the entry level. And then we've got Oregon. Love Oregon. Being from Seattle, I have an appreciation for the Northwest. West Virginia, which is one of the states that has the fewest reported COVIDs. We'll see in the data if that's still holding up. New Mexico, Houston, New Hampshire, Pennsylvania, Humboldt County, California. Okay, so let's jump into the data. Oh, we have Alias HSW from San Fran and Inglewood, California. Okay, I got to jump into the data before you guys all get mad at me saying, hey, let's see the data. You got it. Okay, so our favorite, the Johns Hopkins dashboard. What do we see here? Well, the first thing that comes to mind is, look at this. Remember when the non-China cases were less than the China cases? Those days are over, and we crossed over on March 15th, so about a week ago. Now, there are people who are making the case that they don't believe the China numbers. Well, let's put it this way. Even if China is underreporting, that yellow line is still steep as all heck. So, I mean, whether or not we're more than or less than China in some ways almost doesn't matter. This yellow line is growing. I mean, look at this. From March 15th, 81,000 cases to a week later, 235,000. I mean, shoot, if this were a stock, you would be super excited, but this is not. This is the opposite. So the total recovered line is growing, but you know, there's 235,000 tested cases and only 94,000 recoveries. So hopefully that yellow line will come down. Some people are saying it'll hit its peak in the U.S. I think Governor Cuomo was saying in about 6 weeks. So that would be, I guess, early May. But yeah, that's disturbing. And then if you look at, well, what countries are being affected, it's more like what countries aren't being affected. You remember when it was just like mostly Asia? Yeah, those days are over. Whoa, over zooming. Hold on. Easy there. Touchpad. Okay. So obviously China's full of cases, but you have Southeast Asia, Australia, Sydney has 6 deaths, 533 confirmed cases. And then if you look, wow, look, even the Middle East, used to be Iran was the big one, but now you can see it's everywhere, including Iraq, Turkey, Saudi Arabia. I mean, I was not too long ago visiting Jordan, and that was just a few weeks ago. So crazy how now Israel has 883 confirmed cases, 1 death. Now, if you look at, let's go, okay, Europe. I mean, Italy is just nuts with 4,800 deaths. Okay, so a couple things. One is you've got 53,000 confirmed cases and almost 5,000 deaths. So let's hope that they're not testing enough people. And because if that were really the ratio, that would be a close to 10% fatality rate, which would not be good. And then here, streaming to you right now, I'm in Switzerland, and the thing with Switzerland is it shares a border with Italy, and every day there were about 70,000 Italians that would come in to Switzerland, often to provide day labor. And they clearly brought with them the COVID. Some of them did. And now in Switzerland, we have 7,000 cases and almost 100 deaths, which is quite nuts. France, 500 deaths. Spain, almost 2,000 deaths. I mean, this thing is getting out of control big time. And then let's go to America. In the US, it used to be just sort of like the big coastal cities like Seattle with almost 100 deaths. All of California has had 28 deaths. San Fran. Oh, that's the Grand Princess. That's just one boat. That's nuts. Okay. And then New York has had almost 100 deaths now, 76, and 12,000 cases. And then Miami, over 13 deaths now. So that's the geographic look. It's basically everywhere. But I think the most disturbing chart is probably this one, where that yellow line, if you look at this this chart, but for daily cases, the red bars represent newly reported cases. And as you can see, that red bar is growing. I mean, the last bar is lower than the one before it, but it seems like this, well, let's be fair. It may be already spread and we're just catching up with testing. So I guess that's the bright side. It may not be really spreading more. It may just be we're getting more aware that it's, may not be a Democrat hoax after all. But so that's that data. And I know, guys, like, let's just keep it real. I know I'm making some remarks about the Democrat hoax and how, this is not the flu. And I know there's probably some Republicans out there saying like, hey, man, this Nerds for Humanity, don't be like so partisan. But I'm very disappointed in the president's leadership for the first few weeks of Feb, pretty much all of Feb and early March. Basically, until last week, he really was more focused on how he looked, in my opinion. And then he appointed Pence to lead the task force, which, So now if you look at where the deaths are, there are more deaths in Italy, 4,800, than there are in Hubei province, where, this thing started in Wuhan. So that's kind of nuts. You got to wonder, like I've listened to interviews with doctors in Italy where they're talking about the reality of having to triage critical care beds and ventilators and make decisions about, do you give it to the 70-year-old grandma or the 45-year-old father of two or even the 20-year-old? I mean, I guess that's the other thing about Italy that we're hearing is it's not just the old that are dying and that are requiring hospitalization. It's also, people in their 30s. So if you're listening to this and you're in this of the mind that this is not that big of a deal and this is just like the flu, and therefore you're going to go to that birthday party or you're going to go to that large concert or whatever, like don't do it, man. It's bad karma. Number one, let's say it doesn't kill you, but you bring it and spread it to someone who then dies because of you. Like, that can't be cool. And number two, you might be affected in a literal way, in a very kind of fatal way. And number three, here's the other thing. If you cause someone to require critical care and that hospital runs out of critical care beds and they have to make these difficult triage decisions, you've indirectly affected now a third level of people. So let me show you just a little bit of back of the envelope math since we're talking about critical care beds. And I'm going to go much more into detail about my Twitter kind of liner notes, but let me just show you one tweet that I wrote up that I think kind of puts this stuff into stark relief. So let me show you my screen here. So by the way, if you're not following me, I'm at NerdsFreeAg. Okay, let's do some math. There are 330 Americans. 50 million, according to the census, are 60 and older. Now, let's assume half of them get infected. Merkel in Germany is projecting 80% of people are going to get infected. But let's be, more optimistic, and let's say only half, not 80%, get infected. So now that means 25 million 60-year-old plus are infected. Let's assume 10% of them need the ICU, 10% of those who are infected. So 90% infected, like they may not need anything. So that's 2.5 million, 10% of 25 million need ICU. 2.5 million. Now, the last line is the what WTF line. In America right now, there are only 100,000 ICU beds. So what happens if in the next few weeks we need not even 2.5 million? Let's say, oh, Tom, your projections you're crazy, not 50% infection rate, maybe only 25% infection rate. Okay, well, then we're going to need 1.25 million beds, right? You're like, oh, come on, not 25% infection rate, maybe only 10% infection rate. Okay, if 10% of 50 million people get infected, that's still 5 million. And if 10% of those 5 million need ICU, that's 500,000. That's 5 times more ICU beds with ventilator option than we have today. And I don't see any government officials talking about this. They're talking about how we want more masks and flattening the curve, which we have to do, but we also have to steepen the supply curve. This is where I am no fan of China, but those people built a lot of emergency hospitals in like record time. And I don't see us building any emergency hospitals. I know there's the 2 ships, the Navy ships, But when I ran the numbers, those Navy ships have about 1,000 beds each, and one of them is going for maintenance. So if you need 2.5 million, ordering one ship to New York Harbor, that's great for a press conference. That the numbers don't pencil out. Anyway, all right. So I'll do more of my Twitter ranting later on, but I have actually more data for you guys. I have the best freaking data. You're going to love this shit. All right, here we go. And this was done by the someone's from Shoreline. Very cool. I used to live on Finney Ridge. Okay, let's look at the freaking amazing data. And I know I'm overselling it, but I really do think it's so cool. All right, so this is from what our president calls the failing New York Times, but I quite love their work. I find that their podcasts are really great, and the data that you're seeing now is amazing. So look at this. This is, you see the center here is Hubei province. And you see how the population was traveling, because part of the challenge is that Hubei is a bit of a major city. It's kind of like the Detroit of China, from what I'm told. And that just shows you how people were moving around. So this visualization shows you why stopping travel didn't necessarily stop the spread, or at least stopping travel when we did. So the first known cases happened in this Hunan seafood market, which happened to be right next to a major train station. And in that train station, you had thousands of people traveling every day. You know, that's a big time train station. Now, before I move on, I should call out that when we're all done with this, I really hope the WTO and all of the G7 countries basically say we need a new regime of regulations on minimum food hygiene production, storage, distribution, because if this did originate in the Hunan wet market, and I'm a libertarian, you know what? You want to eat your pangolins and your civet cats. I get it. Like, you probably, some people who eat that stuff are like, well, you eat lamb, you eat baby cows, you eat chickens. I get it. We all eat animals. But what I'm saying is, if you're going to eat these wildlife animals and they have a high probability of having these exotic viruses, number one, you got to find a way to capture or breed them in a sanitary way, store them, process the meat in a sanitary way, and avoid cross-contamination. And if you can't do that, like, that affects everybody. So it's not just like, oh, well, this country wants to do it. Like, and frankly, I know, I get it. There's probably some people out there saying, hey, America, we have our own issues with E. coli. We have our own issues with all kinds of, processed food. Yeah, I know nobody's perfect. But when you have a virus like this that puts the whole world economy on pause for God knows how long, maybe 6 to 12 months, there has to be consequences. And if we need to hold China accountable, like, freaking, I'm all for it. But at any rate, rant over about Chinese wet markets. Because I know it's not just China. There's wet markets all over the world. All of them need to have minimum standards. If you want to trade with the developed markets, like, you need to play by the rules. All right. So now that's the market. That's the train station. Now we know that 4 cases grew to dozens by the end of December. They looked like they had pneumonia. but they weren't responding well to the usual treatment. So at this point, you're thinking, hey, we can handle this. It's just a weird case of pneumonia. The reality is that it was much larger than a few cases. And so there were probably more like 1,000 that were affected, or several times more. And this is estimates from UW in the great state of Washington and the great city of Seattle, and Johns Hopkins from the great state of Maryland. So what you have here is like, oh, there's some people that have pneumonia. That's weird. It doesn't really affect us. And then you're like, wait a minute. It's not a few dozen. It's nearly 1,000. Okay. Now here's the crazy statistic. Read this, man. Each patient on average infects 2 or 3 others. Okay? Let's think about that. If one person on average infects 2 or 3, and those 2 or 3 on average infect 2 or 3, you see how this starts to spread very, very quickly. And why, again, this is not just like the flu. This is not some very normal thing. And frankly, like Ebola and H1N1 and SARS, I don't think they had this kind of spread to them. You know, this is like, you talk about content going viral. Like this is like where it all starts. Like this is truly viral. All right. But now let's hold China accountable. They did not alert the public, their own public, frankly, until in December. It wasn't until the end of December that they alerted WHO, but with a reassurance that everything's under control. So the Chinese government initially is saying everything's under control. This is, we've got this, which, as you probably know, sounds familiar. Other governments said the same thing. All of these freaking governments, bunch of cover your butt people. Okay, so the timing couldn't have been worse because this happened around the time of Lunar New Year, which for those of you who aren't familiar with Lunar New Year, Chinese New Year, think of it as Chinese Thanksgiving, right? You know, the busiest travel day of the year for Americans. Lunar New Year is like mega travel. Everybody goes visiting their family. And, you know, basically you've got, this looks at the amount of movement in terms of hundreds of millions of people traveling to their hometowns. This is data from their cell phones, from Baidu. Nuts, right? And obviously Wuhan is right in the middle. So there's practically a hub. It's like Chicago, or O'Hare or whatever. All right. In fact, on January 1st, 175,000 people left on that day. Okay? 175,000 people. Can you imagine? That's a lot of corona. Each of them infecting on average 2 or 3 and so on and so forth. And they're spreading. It's like a starfish here. And these departures accelerated over the next 3 weeks. Part of the reason is that Chinese New Year it's different than Thanksgiving. Like Thanksgiving, we celebrate it for like, you know, a few days, a long weekend. Chinese New Year is like a couple week deal. So about 7 million people left Wuhan over a period of weeks before they started restricting travel, right? Okay. So now you're like, all right, well, that sucks for China. Not my problem. Well, the problem is that the red dots show the number of travelers infected. So you had millions traveling and thousands were infected. Those are the red dots. You see the red dots now spreading. This is Very disturbing, right? And by the time that the Chinese officials acknowledged the risk of human-to-human transition on Jan 21, local outbreaks were already being seeded in Beijing, Shanghai, and other major cities. So here you see all of the cases and then all the travel. And what happens? 2 days later, they locked down Wuhan, and many cities followed suit in a few weeks. Travel across China pretty much comes to a standstill. So you see now China's, this is around Feb 4, really locking things down. Now, I would argue at this point, if put it this way, if you are a world leader, you should be getting a briefing about what the heck is going on in China and saying, whoa, this is like a huge deal. So we knew this, basically Jan 21, we knew there were this many cases, and everyone in the whole world knew that China was locking down its travel. So it does stand to reason that if China is feeling so concerned about locking down its travel, you would wonder, like, well, what about the rest of the world? Like, why would we want travel from China? But let's keep going. So here you see the spread from it being only in Wuhan, right? Highly, highly contained. But even though they stopped the travel, people had already traveled. So you know, the kind of genie was out of the bottle. And you see those red darts starting to spread throughout other parts of China, right? And it's no longer a Wuhan problem, right? And then by Feb 4th, you see pretty much most of China having major outbreaks. So now again, if you're a world leader and you are thinking about the welfare of your people, like you must be looking at this country that's clearly integrated into the world economic system and massive amounts of travel, and saying like, well, what should we do about this? And as this outbreak moved across China in early January, international travel continued as normal. So look at this is just from Wuhan to Southeast Asia, Middle East, Europe, South Korea, Australia. By the way, if you're wondering where all this is from the New York Times special interactive website about COVID. I'll put a link to it in the description as well. So they fly out from Wuhan to cities all around the world. So you see people going to Frankfurt, Milan, Roma, München, Stuttgart, Prague, right? Way big time, Bangkok, Phnom Penh, Manila, Australia, pretty much everywhere. Over 900 people went to New York every month on average based on those trends. Now, at this point, the US is not doing anything about travel from Wuhan to New York. And I guess you got to ask yourself, if you know that the Chinese are not letting Wuhan people travel throughout China, why would you let them come into your country? I mean, interestingly enough, for a president who loves walls and stopping people from entering the borders, this is the one time where you do want to be really tough and strong on the border. It's not the Mexicans that are bringing the COVID, right? This is coming from China. I mean, that's the reality. In fairness to America, we weren't the only country that was slow on this. Other countries allowed travel from China. So, but I think we all hold America to higher standards as a leader of the free world. There were over 2,200 that went to Sydney. So not surprisingly, I think in a previous Nerds for Humanity COVID episode, we looked at very deep data into problems in New South Wales, and it's not shocking that that was observed given the amount of travel from China to Sydney. If you were in Bangkok, oh my God, that's just a massive amount of flights from Wuhan into Bangkok. And that's where the first known overseas case appeared in mid-January. So now we're in, where are we? End of March. In mid-January, there was someone who traveled from Wuhan to Bangkok despite having a fever, headache, and sore throat. Now, before we vilify this woman, although I'm happy to, because I think she probably ended up killing people, I'm sure she didn't do it knowingly. I don't know. Maybe she did do it knowingly, because at that point, she would not have been allowed to travel throughout the rest of China. So why would she go to Bangkok? So I'll let you guys judge whether or not this 61-year-old woman should not have done that, but she wasn't the only one. She was the first confirmed case. I'm sure there are tons of these blue dots that were infected already. And then you have more travel to Tokyo, Seoul, a little bit to Seattle, Singapore, Taipei, you name it. That's Jan 23rd. 85% of infected travelers went undetected, but were contagious. So this is why, even though the US number of confirmed cases seems low, like some people are like saying, oh, US only has a few thousand, what's the big deal? Well, you need to get tested to know you have it. If there are no tests available, then you don't really know, right? So in this case, there were tons of people who weren't getting tested and traveling internationally. Yeah. And then at the end of January, you finally have airline lockdown, airline flight cancellation. And by Jan 31, US announced it would shut down travel from China. So that's Jan 31 when the US announced it would shut down entry from China. And that's just for non-Americans. But I would argue if you're an American, you should have been tested and isolated, even if you were allowed to come back in. But we know, if we go back, just as a reminder, if Jan 31 was when the US stopped travel, whoops, let's go back here. When did China stop its travel? So they got seated. Okay, so Jan 21 was when China stopped its travel. And I guess Jan 31 is when US stopped travel from China. So about 10 days of flights from China to the US were permitted. Okay, now let's keep going. Whoops. Sorry. Okay. So Jan 31, US stops travel to China. But by then it's too late, because the travelers from Wuhan who were visiting other cities before US blocked the flights, they've already seeded other cities. So those cities have now become self-sustaining centers or hubs of spread. So these red dots show cases as of the day US stopped the flights. This is equivalent to kind of like locking the door after people have already brought the virus in, and it becomes endemic to the country. So you see all these dots in Hong Kong, Munich, Paris, Singapore. And so number one, they've seeded these cities. But number two, okay, did we block flights from Munich? No. Did we block flights from Singapore? No. I don't even think we blocked them now. So that's why just blocking flights from China is a kind of like necessary but not sufficient. So it started spreading locally, moving in confined spaces, especially churches and restaurants, infecting people who had never traveled to China. So that's kind of a key tipping point by Feb 14. Mid-Feb is when this thing is too far. The horse is out of the stable, right? By March 1, thousands of cases are being reported in Iran, Italy, and South Korea. And China is actually no longer the main driver of the outbreak. There's, an argument that probably South Korea, Milan, and Tehran are probably doing more than Wuhan. In fact, as China started its testing and isolating patients, new cases there declined dramatically, showing that it is possible to slow the virus. And similar measures in Singapore and Hong Kong and South Korea have proven effective as well. I will say, we as Americans are taking a different approach than Singapore and South Korea and China. And, as early as, or as late rather, as March 11th, the president said that while we've suspended most travel to Europe, the virus will not have a chance against us. Because USA, right? Like we're not going to be defeated by some virus, according to the president on March 11th, guys. That's 11 days ago that he said this. The virus will not have a chance against us. Well, the reality is that it did have a chance. And by the time he was saying these things, it had already passed in New York, Seattle, Bay Area, Los Angeles, major metropolitan areas, and it was spreading. New Orleans, Florida, wherever there are people, there is COVID now in America. And that is the end of this special New York Times interactive thing, which is so cool. So I don't know if like the spam filters will let me add a link, but hopefully that works for you guys. But just go to NewYorkTimes.com and they have an interactive thing. Okay. I have more data. Do you guys, was that too much? You guys, I don't know if people are still with me. Let me know. I know it's getting, we've been doing this for 43 minutes. If you want a little more data, I have more, but I also don't want to press my luck. So I'll look in the chat to see if you guys want some more charts and graphs, and me being kind of disappointed in our presidential leadership. All right. Okay. All right. You guys want it? All right. Oh, don't forget to like and share this if you're finding this interesting and useful. It helps the channel get more awareness. Okay, here we go. More data. I think I did that one. Let me see. Hold on. Yes, that one I did. Oh, let's look at data on how Americans are viewing this situation and how that's shifting. So this is from 538. And where's the chart? Here it is. So this is the percent of Americans who either are very or somewhat concerned about COVID-19 And you can see here that the chart goes from all the way on the left around Feb 2nd to pretty much a week ago. And as you can see, early all the way until really middle or end of Feb, really early March, most Americans did not say they were even somewhat concerned. Oh, actually, you know what? Rock, you make a good point. Would you guys mind? I have a little, like I mentioned, I have a little cold. But again, I have a runny nose, and unless the virus has mutated, like I just have the flu. But I'm gonna just refill my water, and I'll be right back. But while I do that, you can look at this chart, and you can see how until really, frankly, mid-March or early March, like a week or two ago, most Americans did not think this was a big deal. And I'll let you guys in the chat discuss why you think most Americans were not concerned about this. I think you know who I think is at fault. But anyway, let me get my water. I'll be right back. It'll be very interesting. All right. So, whoa, stop sharing. Okay, here we go. We're back. So that basically shows you that now majority of Americans are concerned about this. And let me just see. Yeah, YBAN is saying that it's because people said it was host. And oh, my brother Peter is here, who is MAGA. And he says that I like to blame the president. Well, I like to hold our president accountable for leading the greatest country in the world and being very competent and data-driven. But I appreciate how many people may say that that is too unrealistic. Now, let's look here at, speaking of Trump, I think I have a bigger chart with his approval rating. Here we go. The Trump approval rating. Look at this. Okay. Here you have on the left-hand side, you see the dip in the approval rating around the impeachment time, sort of around October. And that's to be expected. You know, the guy's getting impeached. They're talking about all the funny business with the Ukrainians and the help from the Russians and quid pro quo and holding military aid and all that good stuff. But then he kind of like recovers after the after the oh, wait a minute, this dip was not during the impeachment. The impeachment is around here in towards the middle of this chart. I think the impeachment was they wanted to get it done before the end of the year. So it was around here. This might have been just like, oh, he's been elected and people are not sure about him kind of time. This here in the middle, whoops. Ooh, look at this. Yeah, here we go. Now we got the dates. So he dipped to about 39% around, this is impeachment time. I think when he was around here was just sort of early, you know, when he had like all of the people resigning or firing people, whatever, you know, when he was going through the first or second cohort of his cabinet. But what's more important is if you look here, like this is the middle of the crisis and it's March 20th. He has 43% approval. And he had 43-ish% back in the summer. And then he had dipped down to 39 during impeachment, but then came back up to 42. So his supporters, you know, are pretty locked in. Like, I'm not sure what he could do to lose their support, because frankly, like, geez, he's what more what more can he screw up when it comes to this crisis? This is just looking at other presidents' kind of approval rating over time. You know, like you could see after the same amount of days, Obama had a 48% approval rating. Trump's at 43. Bush had a 48. Trump's a 43. Clinton was 52. Wow. Good old Bill Clinton. HW actually, okay, so Trump is more popular than George Herbert Walker Bush, which, if you're a Trump supporter, is good news, because as we remember, George H.W. was not reelected. People loved Reagan at this point. He had 54% approval. So Trump is probably closer to more like a Jimmy Carter in terms of his approval rating. Yeah, I don't think we need to go that far back. Whoa, Dwight Eisenhower. My God, 72% approval rating. That's crazy. And then Kennedy had a 58. So TLDR, people who support Trump, they are going to support him pretty much through thick or thin. I don't know, like, what needs to happen. Maybe if he really screws up. I mean, I kind of feel like he did really screw up this COVID thing. Like, he didn't stop the travel. He has not ordered enough emergency hospitals, ICUs. He hasn't ordered production of ventilators. He's giving medical advice about malaria medicine and then contradicting the head of the CDC, like, right in front of the guy. So to me, these would be grounds for saying I disapprove. But obviously, as my brother Peter would say, I'm always looking for reasons to disapprove of Trump. But Peter, it's not that hard. Any rate, okay, so now let's look at betting odds. Betting odds. This being the world, people are betting on COVID. So one of the things that economists will tell you is that gamblers are probably one of the best indicators of reality, more so than what politicians tell you. So here, first of all, let's look at who's going to be elected president, election betting odds, and then I'll go to the COVID stuff. So pretty sure that Biden is going to be the nominee. He used to be like a 50% chance. Now he's at 89. So if you look at him in the last week, let's look at the chart actually. So Biden is the blue probability of being the nominee. And there was a point where Sanders and him were 50-50 back at just a few weeks ago, end of Feb. And now it's pretty much the Biden show. So we don't need to talk about that much anymore. But then in terms of who's going to be the next president, it's pretty much a toss-up between good old Donald Trump and Biden, each having about a 46% chance. So Pence is next, and then somehow people would bet on Hillary Clinton, which would be just freaking crazy. But anyway, that's what they're betting. Now let's look at COVID. How many cases will there be in the US by March 31st? Okay, so as a reminder, let me just check the latest numbers in the US. Right now in the US, as of the moment, we already have 32,640 confirmed cases in America as I'm recording this now. And there is a 97% chance that we will get to 100,000. So 3 times as many as today in the next 9 days. according to the gamblers. So the gamblers are not feeling nearly as optimistic as our elected leaders, or at least some of them. So just a reminder, I'm going to show you the actual data. Where is it? This one. Okay, so US, you've got 400 dead and 32,640 confirmed, right? 32,640. And today is March 22nd. So the gamblers are asking themselves, well, what do we think it'll be on March 31st, 9 days from now? The gamblers think it will be over 100,000 in America. Yikes. Now, if you look at what the gamblers think of the world, worldwide cases, let's go to the actual data. Worldwide cases is, let's not go here. Let's refresh. $329,000. Call it 330,000 today worldwide. And now let's look at what the gamblers are saying. The gamblers think that there will be at least 500,000 in the next 9 days. 500,000 to 1 million. In fact, the gamblers think there's a 25% chance that we will go from 300,000 to over 1 million confirmed. So that's pretty nuts. This is the red line is a million plus one. Very few people think that we're going to stay under 500,000 in the next 9 days. So if I've learned anything, these gamblers from their predictions about Andrew Yang are probably pretty accurate. So that is the election betting odds. And I would say to Abacus, the gamblers are using math because they will make money if they do. And if anyone's not using math gambling, then they will be taken advantage of. So hopefully, like, these markets are fairly efficient, these gambling markets. Okay. Next, I'm going to do 2 more things, take some audience questions, and then wrap it up because it's getting late over here in Switzerland, and I got to go to work tomorrow. All right, let's look at some kind of good news or just kind of crazy. This is the new world order. This looks at traffic data from March 1 to March 19. And you can see how basically year over year, last year, 2019, LA, lots of emissions from cars, and then now considerably less. This is the 110 Harbor Freeway on a Friday afternoon. That's pretty crazy. You can get right to the Civic Center or downtown, and there's like no one there. So that's kind of zombie times. Traffic speeds along the 110 in US, 60 miles an hour. Typically, it goes down to 30. Seattle, same difference. A lot of traffic, no traffic. New York, actually, there's still some emissions, So I don't know if that's good or bad for New York, but it seems like folks in New York are still driving around. I guess it says here they're less dependent on car travel, so they have other sources of their emissions. So that's that. And then the next thing I want to show you is there is a new Google website for COVID information. It's google.com/COVID-19. I'm going to just post it here for you guys. But let's just take a look together and nerd out. Okay. So first thing they have here is some good health information. And this is how I found solace in the fact that I don't see runny nose and headache on this list for symptoms of corona, which is what I'm currently experiencing. So I think I just have a straight up flu or cold. They give you prevention tips, washing your hands, covering your nose and mouth with a flexed elbow, 3 feet of separation, self-isolation. Don't touch your eyes, nose, or mouth. Treatments. So, according to the WHO, there is no treatment. You can just get supportive care to help you breathe when your lungs start to fail. Obviously, there's a controversy where President Trump thinks that you can use a cocktail of malaria medicine, but that has not yet been proven. So I would trust the CDC. And then they have safety and prevention tips. The 5, wash hands, elbow cough, don't touch your face, keep a distance and stay home. Bunch of videos from WHO, CDC, basically people who believe in science and math and data, which is always good idea in times like these. But they also have some data insights, so you can see the areas affected. So this is kind of like the Johns Hopkins one, but it's color-coded a little differently. So I'm going to share that one just so you can get a sense of the magnitude of spread. Hold on one second. Is it this one? Or is it this one? It's probably this one. Yeah. So here you see the, this was updated less than an hour ago, and this is just the number of confirmed cases. So as you can see here, obviously China, still a big deal, but Iran, most of Europe, and the US, 32,000 cases. France, Spain is getting up there with 28,000. Italy, 60,000. Iran, 20,000. China, 80,000. So US is a little less than half of China. And looks like Africa has a little bit less, but you notice the Southern Hemisphere still has it. Like Australia has over 1,000 cases. So I don't know that I would bet the farm on waiting for the weather to warm up. So that's one piece of data, but I have more from that Google site. Let's see here. Top searches related to coronavirus. People are looking for updates, cases, symptoms. A lot of searches in Uganda, Spain, and Italy and Australia, basically where you see a lot of things happening, and then they have a bunch of resources for you. I thought I had some more data. Yeah, I think I'll go to Google Trends. And you see here, people searching for California lockdown rules. Are fast food restaurants open? Tax deadlines? Will grocery stores still be open tomorrow? And then what is a dry cough? What is martial law? Is California on lockdown? Rand Paul. Search interest around unemployment benefits, testing. I know the president said that if you want a test, you can get a test. I don't think that's true. If you don't believe me, go try and get a test. School closings. And basically everyone in the world is searching for this stuff. A lot in Spain. I think they're realizing that they might be the next Italy. And people asking about preventive measures, lockdowns, that kind of thing. So that is it for the data. If you guys are still hanging around, I'm going to give you a very quick bonus conversation about my Twitter rants. So a lot of it is about Corona, but some of it will be about the 2020 race. So if you're not interested, if you just came here for the charts and data, we're good. We won't be showing anymore. But if you are enjoying the conversation and you just want to hang out for a little bit more, I'll kind of give you my liner notes on what I've been tweeting about. And then maybe I'll take some questions and we'll move on. Okay. All right. So quick liner notes. Share. If you haven't, please follow me on @nerds4yang. And by the way, if you're joining late and you haven't already, please like and share this live stream so that more people can discover it. So we had a big interview this Friday with Andrew Yang himself. Had 5,800 viewers just on Twitter and another 5,000 on YouTube. So it hit 10,000 views in about a day, which was cool for our little Nerds for Humanity channel. And Yang talked quite a bit about the Humanity Forward movement and his pilot to provide COVID-19 relief aid in Brooklyn. I think he's raised $1 million to do that. So, you know, that's an example of someone who's like doing stuff. I was going to say doing shit, but yeah. This is me being live right now. I just had an interesting interview with Kristen Slevin, who is a former Republican, I think Yangocrat is how she would describe herself, talking about starting nonprofits and running for office. I've got 9 interviews lined up, including Republican running for Senate in Montana, Dan Larson, who's trying to challenge the incumbent Republican. Got Herzog running for Congress, Heidi for Congress, Arturo mainly goes by Tully, Roberto Blake, Blair Washington for Congress, Lacey Delane, the Yang Scream from Georgia, and Andrew Wan from the, I think, Youth Activists group. So if you aren't subscribed to this channel, go ahead and do it so you don't miss out on these great interviews. Oh, dudes, you are going to be, you are going to get a treat if you haven't seen this video. I got to turn on audio for you guys. This, I swear to God, I crack up laughing every time I watch this little video. Hold on a second. Let's pause it. Let's go back. Let's turn on sound. Hopefully you guys are going to be able to hear this.
Because of coronavirus, you are going to be quarantined, but you have a choice. Do you A, quarantine with your wife and child, or B. Because of coronavirus, you are going to be quarantined, but you have a choice. Do you A, quarantine with your wife and child, or B.
Oh, shite. I'll put a link to that one in the chat if you guys want to check it out as well. All right. Moving on. Let's see. Hold on. I talked about Mike for Kentucky, who is a former U.S. Marine lieutenant colonel and is now a farmer in Kentucky. He's challenging Mitch McConnell. If you haven't checked out Mike, check him out. He's legit, in my opinion. This is his, I think this is his niece saying, hello, nerds, Nerds for Humanity. That's awesome. This is me doing a survey of what worries most people about Corona. And most people seem to be worried about their families getting affected. A lot of people are concerned about the economy. Luckily, not many people are worried about grocery stores. I'm most worried about hospitals being overrun. We ran those numbers already. This is me being angry at Trump for giving medical advice, and he probably needs to talk to his makeup people as well. And then this is me grilling some wings before my interview with Mike from Kentucky. This is interesting. The Putin administration is claiming fewer COVID cases than Luxembourg. So there's that. This is the math we did earlier, but I'm going to go through the whole thread. So remember this one, 330 million Americans, 50 million are 60 and older. If you assume half of them get infected, that's 25 million infections. If 10% of infected need critical care, that's 2.5 million, but there's only 100,000 ICU beds today in American hospitals. So it would be 225 times the demand that would be crashing on these hospitals. So here's a data visualization about why everybody's talking about flattening the demand curve for care, which is to flatten the spread. But if you look on the left, even if you do flatten that demand curve, it could be as much as 25 times how much you need. So I would encourage everyone to ask their elected leaders, what's the plan? Because I don't feel like we're getting an answer. We're getting a lot of, don't worry about it. We have this new medicine. It's going to be fine. And I don't buy that. This is a visualization of how fast this thing could spread by mid-May, depending on whether you have some control measures or no control measures. Now, the interesting thing is, I know, Peter, you're saying you're complaining about open borders, but you live, America is a country with open borders in that people in every state are able to travel throughout the entire country. So you may want to think about your anger about open borders and maybe look a little closer to home. All right, so that was that one. And then, so, you know, Trump talks about those 2 Navy ships. Just for numbers, each of those Navy ships have, whoops, stop sharing screen. Let me come back. Each of those naval ships have capacity for 1,000 patients. So if you need 2.4 million new beds, 2 ships is not going to do it. So don't let anybody tell you that those ships are going to solve our problems. Okay, then if I go back, this is, we looked at this earlier. This is the daily cases. But what I was trying to make the argument was that, you know, people, I've seen news of people still going, especially like in some parts of the country, to concerts and amusement parks and hang out in large groups. And I hope if you have friends that are not taking this seriously, that they start taking it seriously because they're affecting other people. So this is just me being angry at people who are like going to spring break parties and stuff. It's just ridiculous. This is me kind of being disappointed that Trump is calling it the Chinese virus. I mean, for sure, it originated in Wuhan, China. His argument that, well, I call everything that originated from a place by its name. There were a lot of things that came out of China, like printing and gunpowder and compasses and clocks and steel and pasta. But we don't always call it that. Now, we could argue about, like, okay, is this identity politics or not? But is this somehow unifying the world by calling it China virus? You know, on the other hand, after the dust settles, again, I'm all for massive economic repercussions for China if they don't get their food distribution and production standards way up. So I'm no apologist for China, but I just don't know why you're calling it the China virus, especially since there's so many Asian Americans who are, you know, already dealing with some discrimination because of this stuff. Then what do we talk about? I thought I had another one, another interesting number here. Hold on one second. Maybe those are most of them. Oh, this is a good one. So you remember when Trump said that no one in their wildest dream could ever have predicted Corona? There's actually a real billionaire who talked about this in great detail. And it was basically Bill Gates 4 years ago talking about.
The reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic. Let's look at Ebola. I'm sure all of you read about it in the newspaper. Lots of tough challenges. I followed it carefully through the case analysis tools we use to track polio eradication. And as you look at what went on,
this video is from
the problem
2015.
wasn't that there was a system that didn't work well enough. The problem was that we didn't have a system at all. In fact, there are some pretty obvious key missing pieces. We didn't have a group of epidemiologists ready to go who would have gone, seen what the disease was, see how far it had spread. The case reports came in on paper. It was very delayed before they were put online.
At any rate, if you're interested, this is a TED Talk by Bill Gates saying we're not ready for a virus epidemic. And that was in April of 2015. So when you hear people say nobody had ever expected a pandemic, just know that Bill Gates expected it. Even the US CDC expected it. A lot of people saw this coming, and don't give people, our leaders, a get out of jail card on this one, because scientists have been talking about pandemics. The US military had been talking about this. By the way, while we're on this topic, the US military has also been talking about climate change. So if you ever have a president say nobody expected massive climate change in their wildest dreams, you should call BS on them, because you can find tons of peer-reviewed scientific research reports about the risk of a pandemic and biological kind of threats to national security. And it's not always about building walls on the Rio Grande. So at any rate, let me just do a little more Twitter liner notes, and then I'll calm down because I'm getting pissed again. But so my tweet was that maybe Trump should watch less Fox and Friends and watch more TED Talks, because these three, they're not hired for, they're not the intellectual brain trust of America. Let's just say that. And then let's see, it's me promoting the. Oh, this is on March 9th. So remember, we all looked at that data about how we had stopped flights coming in late January. China had stopped travel within its country in mid-January. And here's on March 9th, the president, these are his own words. I'm not making this up. I'll just let you guys read it. It says that the fake news media and their partner, the Democrat Party, is doing everything with its semi-considerable power, it used to be greater, to inflame the coronavirus situation far beyond what facts would warrant. The Surgeon General says that the risk is low to the average American. So this is not me being hard on Trump, Peter. This is not Trump saying this like a year ago. This is March 9th, guys. March 9th. It's 13 days ago that he said that it's just an inflamed Democrat hoax, far beyond what the facts would warrant. So, any rate, that's our president. So I got pissed about that. And then the other interesting thing, if you want to look at the data, is that 90,000 people liked that tweet. If you go here, you see when he was, actually 91,000 Americans liked the president's tweet saying that this is not a big deal. There's no risk. 25,800 people retweeted it. So that's one way to be a leader in a crisis, blaming it on your political opponents and calling it no risk to the average American. Freaking Donald Trump. Oh, this is interesting. So you want to see how one country does it. Those Singaporeans, when they test someone who's positive, they assign them to stay at home notice, right? Or if they come from another country, even if they don't test positive, they have to self-isolate for 14 days. And how do they do it? Well, you get a notice at the checkpoint. You get these text messages that are sent at various times of the day. And you have to give an update on your location with your GPS from your mobile phone. They do random house calls. If you get a phone call, you must take photos of your surroundings to verify your whereabouts. And my understanding is that if you are infected and you are caught walking around outside without permission, it's like a $10,000 fine. So, I'm not saying that America should do what Singapore is doing, but I will say that they are not playing. The Singaporeans, they do not play. And maybe that's why they have far less spread and deaths per capita than many other countries, even though they were victims of a lot of traffic of visitors from China. Okay, then this is me yelling at people saying like, dudes, don't go to these large social groups and party over spring break because it's bad karma. This is, I think it's pronounced Cenk from Young Turks, and his kids are half Chinese or Chinese ethnicity. And basically his kids are being blamed for spreading the virus and being asked if they eat bats. And his 9-year-old son came home and asked him, if it was true that it was his fault. which is very sad. Another reason why calling it the Chinese virus is not cool. Let's see. Yeah, this is him saying that Trump calls it the Chinese virus because he was angry that people were saying it was developed by the US military. Generally, I have found that when you use anger as a reason for doing anything, it's generally not a good leadership principle. Every time I've done something out of anger, I usually regret it. But I'm not the president. This is me talking about the Yang interview. This is me sharing some data from Governor Cuomo, who on the New York Times Daily podcast was projecting that the apex was about 45 days away and that they may need 110,000 hospital beds for New York State, but they only have 50,000. But even more concerning is their projections indicate that they may need 37,000 ICU beds, and they only have 3,000 in New York State today. So this is my point about, I know a lot of people following this channel are former Yang Gang, and we're very fired up about UBI, but UBI is not going to help you if you need a ventilator. And if you're in New York State and you're one of the 37,000 that they project may need a ventilator, and they tell you, well, we only have 3,000, what are those 34,000 going to do? How many of them will die because they didn't have to? So that's pretty crazy. And then this is me saying, like, hey, why hasn't the Army Corps of Engineers and other construction companies started to scramble and build temporary hospitals? I know we got the 2 Navy ships, but we need more. Okay, here is a projection by the Harvard Global Health Institute of hospital beds in a given city. In this case, it's Des Moines, Iowa, if infections spread out over 6, 12, or 18 months. So if infections spread and you get 60% infected over 6 months, the red line indicates the point where you exceed the number of hospital capacity in Des Moines. If, on the other hand, it gets spread out and it spreads out over 12 months, then here's the red line indicating that you also exceed your capacity. Even if it's spread out over 18 months, you exceed capacity. There is a scenario where you have enough hospital beds in Iowa. It's if only 20% get infected, and those who get infected are evenly spread over the next 1.5 years. Then the folks in Des Moines will be fine. But as you can see from this data, the hospital bed shortage, the critical care supply capability, and it's not just the ventilators, but it's also the ICU beds and the nurses and the doctors. Those red lines should not be below the top of those bars, to be clear. When you go over the red line, you're FUBAR. Ask yourself, when was the last time you heard President Trump or Vice President Pence talk about this problem? Like, I'm not making this up. This is math. If enough people get infected and they need hospital beds, and we only have so many hospital beds, what are you going to do? Man. Okay. Okay. Lastly, here's the long ass tweet I had. Yeah. So here's so we talked about the Governor Cuomo. We talked about the need for more ventilators. We talked about how if you look at any major city, we're screwed. We can't just flatten the curve. We need to steepen the supply curve. And here is my challenge to not only President Trump, but also Vice President Pence and Dr. Fauci Answer these 3 questions. As Americans, I believe all of us should demand answers to these 3 questions. Mr. President, what is our current critical care and ventilator capacity? Please give us a number. Please do not say we're working on it. Please do not say we're so impressed with our governors, how closely we're working together. We're on top of it. We have it under control. I want a effing number. And don't tell me millions. Don't tell me, oh, it's unbelievable. It's perfect. I don't want that shit. I want a number. Number 2, what do your experts project demand could be in 6 weeks? Please provide a quantitative range, a min and a max. Number 3, what are you doing to reconcile number 1 and number 2? Please provide specific actions and milestones with dates so that we can track progress. Has anyone heard Trump or Pence talk about this? Cuomo's the closest. It's ridiculous. It's ridiculous. The guy talks about being this great CEO. He spent 2 years as a transfer at Wharton, and he doesn't talk about numbers, and he doesn't have any consistency of facts, and he just makes stuff up. Fucking. All right. Last thing I will say is, let me just call out some. So need to calm down a little bit. Need to calm down. I think whenever Peter shows up in the chat, I get really fired up. You know, Peter, I love you as my brother, but your MAGA freaking allegiance is like crazy. At any rate, I see we have a super chat here from Jennifer Montgomery. So I just want to call out the super chat money is going to help promote this channel. So I'm now spending some of that money on Spanish audio dubbing for some of our popular videos, but also on ad campaigns in Facebook and Twitter to try and like grow the Nerds for Humanity audience, so more people get to see the data and benefit from information that we can share and the interviews that we do. Jennifer saying we may not need to build more hospitals if we repurpose hotels and motels. Yes, I'm fine with that. That could be part of question number 3, which is how we reconcile current supply and projected demand. And it could be hotels, it could be motels, it could be stadiums, it could be universities, it could be community colleges, it could be military tents, whatever. Like, I'm all for it, but I want to see them do it. I don't want to see this whole, everything's fine. It'll be fine once the weather clears up, and don't worry, the stock market will be coming back. Yeah, of course, I want the stock market to come back. I also don't want a bunch of people to die because we like lollygagged arguing over tax breaks for companies. Like, we got to take care of our people. It's a freaking crisis. Okie doos. I will wrap it up here, and I will take a deep breath. And people want Peter back on the stream. Peter, you know what? If you're on the stream now, do you want me to send you a link? You want to jump on right now and say hi to people? I'll look in the chat if you guys want to see me and Peter talk. But as you can see, I'm a little fired up right now. I'm not going to be super like, oh, Trump is amazing. So Peter, if you want to come on, I'm going to send you a link now. All right. I'll send you that link. I'll do it right now, Pete. Hold on. Stand by for link. Now you guys are about to witness potential Leung family feud. Just sent it to him. All right, Peter, it's in your WhatsApp. Reef saying, fight, 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 fight. All right. No mercy. Oh, it ain't gonna be no mercy in this dojo. I'm gonna freaking sweep the leg. Now, Peter may be afraid to come on because he is indeed my real brother. And you guys, if he comes on, you're gonna see that he and I are not the same at all. Oh shit.
Hey, do I need to turn off the YouTube?
I can hear you fine now.
Okay, I turned off the YouTube.
You can turn off the YouTube. Good. You know, Bernie Sanders says that people should use the YouTube. So what's your take, man? You know, I just lit into Trump saying, I want answers to these 3 questions. Are you saying he already gave them?
No, I think those are good questions. I haven't followed those questions because I was actually coming back downstairs off my rooftop. So, I mean, I think those are good questions. I mean, if you want talking about questions for future chat, you know, using hospitals, makeshift hospitals from universities and stadiums, that's a great idea.
Yeah, the questions were, what's the current capacity? Give a number. The second was, what do we project demand to be in the next 6 weeks?
You have to have a follow-up question with those 2 questions. Is not only what is the projected number that you have and what you need, but how long are those people going to be on those ventilators? Because they might need to be on the ventilator for 10 or 30 days, you know?
Yeah. So you could say number 2 could be, what is the projected demand in the next 6 weeks, 12 weeks, and 6 months?
Yeah, you'd have to do like an Excel spreadsheet on that, because like when, you know, bed number 1 is activated, it's activated for 30 days, then bed number 2 is activated, and then, you know.
The reason why I didn't even go into that detail is I don't even think we have enough for day 1.
Right, we don't.
So what are we going to, so then hence question 3, which is, how do you reconcile number 1 and number 2?
Right, but we're not getting into a big discussion on it. We're just chit-chatting.
Oh, okay. All right. So what do you want to chit chat about? What do you think?
Yeah. I mean, I think, you know, it's bad. I mean, I'm just wondering, like, most people in the U.S. are staying inside. I think right now, if you look at the live cam, which is shared in family chats, Los Angeles is a dead city. So is New York. So is Miami. So maybe, good thing, maybe the virus will just burn itself out. I don't know. I mean, I'm also do think that we will hit 100, 200,000 cases in the U.S. soon. But on the other hand, if you're not going out, like, I know you're in Zurich, but I'm not going out. I'm not going to get infected. Hopefully, touch wood.
Yeah, I think a lot of people are already infected.
Oh, really?
And I think eventually people will need.
Incubation is about 5 to 8 days. So let's just say I was infected. I've been staying at home for 10 days. Then, you know.
So number 1, you may have been asymptomatic. Number 2, we don't yet have data on reinfection rates. Like if you take as an example, flu season, I've had flu seasons where I've gotten the flu more than once.
Right.
I thought, like, I got it, I was done, and then you get it again. The third thing is the data from Italy is showing different demographic problems than in China. You know, in China, everybody was talking about the 60+ crowd, right? Being the most susceptible. But in Italy now, there are as many people in the 20 to 45 crowd, almost as many in the hospitals as the 60 and over crowd.
Well, I don't think it's a fun thing to risk, even if you're not over 60, to get, because, you know, maybe the bulk of you will be asymptomatic or just mild, but, you know, you don't want to end up in a hospital. I've never been on a ventilator. I've never had anything, you know, to keep me breathing, and I don't think it's a very pleasant, you know, thing. So,
yeah,
we should all be following the rules.
Well, the other concern that some doctors and scientists are saying is that, why is the demographic data in Italy so different than China?
I thought it's a different strain, or what? That some people are saying.
It could be mutating.
Yeah.
And if it's mutating, I know some people say that you can take a cocktail of malaria medicine and it'll take care of it. But whatever cure we come up with may not even work. Because think about the flu vaccine. They get it wrong every other year practically. And they're like,
Hey,
well,
what do you think of Como? I think Como is pretty presidential.
oh, I find Cuomo to be very much acting like a commander in chief.
Yeah.
And but you know he's not you know he's not MAGA, right?
He's not Republican?
No. Yeah.
No, I know. But he's actually, I mean, I watch his daily briefings. It's very informative.
Yeah, I think in the past you called him a snowflake.
I don't like his brother on CNN.
See, sometimes these snowflakes can actually be decent people, just so you know.
Yeah.
A lot of people are saying that your dog is very cute.
Okay,
And,
good.
you know, that's kind of BS because I don't have Daisy with me right now. Let me go get Daisy. So
Let
we
me
can
get my
have
other dog.
a dog showdown.
Let me get my other dog. I have 2 dogs. Ah! This is Happy. This is the Happy, the other dog. I shaved them down. I can't see your chats, but yeah, this dog is Happy, and then my other dog is Dopey. 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 I shaved them down. I'll tell you why I shaved them down. For those of you who have dogs, is, you know, if you're walking your dog in the street, which I'm still doing, there may be corona all over the place. So I'm trying to keep the dog low with less hair, so less chance of corona being on their hair. And then when I bring them back home, and I wash them down after every walk, just so you know.
Now this is a dog. This is a real dog right here.
So
Right, Miss Daisy?
I can't see it.
What do you mean you can't see?
I only see your picture. I don't see it. I don't see like any video. I only see your picture. It's very
Well,
weird.
oh, maybe because you're on mobile. Let me put Daisy down. All right, Daisy.
Yeah.
Oh. But at any rate, Daisy's a way better dog. Any rate, so going forward, here's my concern. How long can we pause the economy?
Yeah, that's a big question. Just gonna.
You know?
I think that's why Trump was afraid of shutting down everything earlier. Because I was talking with one of my friends, and he's not even, you know, very financially smart. But he said this 1 or 2 months ago. I was like ranting. I said Trump should have closed down Europe, everything when he shut down China, and he said that would have killed the economy more than the virus would kill the economy. You know, so.
Well, you run the numbers. Let's say 300 million people. Let's say 10. Let's be conservative. Only 10% get infected. That's 30 million, and 10% of those need ICU. That's 3 million. But we only have 100,000 ICU beds. So let's just say, 20% of those who don't get the beds die. That's still 600,000 deaths.
Yeah.
I mean, that's makes 9/11 look like nothing.
Yeah. No, I mean, actually, the world, if you watch a lot of this pandemic stuff, I mean, the world is actually long overdue for this type of virus. I mean, the Spanish flu was about 100 years ago, right?
Yeah.
That killed anywhere from 30 to 50 million people. And they didn't have the type of travel that we have now, you know? Obviously, we know a lot more about viruses than we did back then. Apparently, like, priests were also helping spread the virus because they were giving people last rites, and then they would carry the virus on to other people. So we know a lot more now than we do then, but it doesn't mean, like, again, something like this will probably again happen again. They wiped out species before. We're not the only species that probably got wiped out.
Yeah. I mean, this is kind of like the equivalent of a periodic forest fire where nature removes or culls the herd a little bit.
Exactly.
But
No,
I would
I don't
say,
feel- I
like,
don't
that
feel good
doesn't
about it.
mean we should not take action, decisive
No.
action to
Yeah,
stem
so
it,
you
right?
asked the question. Yeah, that's a very good question. How long can the economy last like this with basically nobody working? So yeah, I don't know how long it's going to be, but at some point the economy is going to break. I mean, the economy is already broken. There's nothing going on.
There's not a
Like,
lot of commerce going on around you right now.
yeah, there's nothing. How can you be a hairdresser? How can you be a massage therapist? How can you be even a dentist? Am I right? Personal
Well,
training.
and this is where you want to, if you want to run the even more difficult numbers, which I presume, I hope someone in the task force is doing.
Mhm.
At some point, you have to run the numbers of how many people are going to die because they lose their job and they can't afford their medicine, or they can't afford food, or they become substance abuse, or they become homeless. Like, there's a cost to putting a pause on the economy. And this is why I know the Nerds for Humanity audience, a lot of our Yang Gang, and we love the UBI. Part of the Freedom Dividend worked because it was funded by a VAT, but you don't get any VAT revenue if there's no value being added.
Exactly. So, like, for example, I mean, I don't know how many UBI checks would have to go out, but, like, let's just say there's 340 million Americans, but you're not going to give UBI check to every American. So let's just say 150 million or 100 million Americans. But then you times that by 1,000. I don't have, calculator in my brain, but, that number gets very, very big when the federal government doesn't have income coming in. So, it's going to be like a big hole.
Yeah, if I were advising the president, I would say your number one goal is to increase the supply of these critical care and hospital beds, because once you get it enough, you can slowly transition back to opening up the economy, because when people go back to work and they get infected, at least we can give them care.
Yeah. Hey, one thing I want to add, I think Trump is misled the public on a lot of this stuff, not out of malice, but actually out of to protect humanity. Okay, this is my thinking. Is, for example, like, a lot of the government is telling you that you don't need PPE, you don't need to wear masks, but all the governments in Asia are telling the public to wear masks, and all the people in Hong Kong walk around with masks. And there's a shortage of masks right now. So even Cuomo's asking people to donate, like, construction masks, dentists to donate masks. So maybe Trump was downplaying this whole thing again, a few weeks ago, because he don't want people to panic and he wants to get everything kind of in place, maybe for, worst case, as, I've discussed privately, maybe martial law, National Guard troops, Humvees, tanks on the ground. I don't know.
I could buy that. I could buy there being a meeting where they were saying, look, this is how many masks we have in the country. This is how much we need.
Right.
And this is how much we're going to need for the medical professionals.
Yeah.
And then they probably said, look, we can do one of three things. We can tell them the truth, but the worry will be there's going to be a run on masks, right?
They will be mass looting. They told everyone the truth like 4, 5, 6 weeks ago that this thing was contagious, where you could touch a surface, and we don't have enough masks, and we don't have enough ventilators. People are going to do the math. The market would have crashed back then. And, I think that, they were just trying to delay, they were trying to flatten the curve, but also delay any crisis, just push out this crisis until, they had more time to just get things in place.
The cost is that for many people, maybe not you, but for many people, the president has lost a lot of credibility. And there's going to be a time where he's going to need people to believe him. And if he lies about masks and he lies about the temperature, it's going to warm up in April, and he lies about, well, this is just a Chinese thing, we have it under control, it doesn't affect the average American. At some point, I think the people will say, I don't know if I believe you. Oh, by the way, I want to say welcome to Emerald, who is a new member of the channel. But yeah, so I know what you're saying. Like he didn't want. Maybe he was trying to avoid mass hysteria.
Yeah.
But you know,
I mean,
like this is you have to like we're a democracy. You got to give the citizens some credit, right? Like you can't say like, oh, you're not mature enough to know that masks help you prevent the spread.
Yeah, but sometimes in case for national security, I mean, this is like a national security issue. You have your economy in crisis, you have your healthcare system in crisis, and potentially you have social chaos.
I would be more sympathetic to that argument if I saw the Army Corps of Engineers building temporary hospitals, and I saw an order for manufacturers to produce ventilators using the.
I think the Army Corps of Engineers was asked, and Cuomo did mention Army Corps of Engineers are supposed to help spec out and retrofit these hotels and universities.
Well, dude, they need to do it now. This is like a war. This is not like we should talk about it.
Yeah, I mean, Trump needs to activate the National Guard. I mean, basically send out the troops.
I don't see it happening.
I'm a big fan of that. Martial law.
Well, I'm not sure we need martial law. Let's be. That's where you and I are going to disagree. But I think there needs to be more robust. There needs to be more
military.
There needs to be more robust
law enforcement.
Okay, I got it. I get you. Can we just agree that we need more medical capacity, and then we'll park the whole whether or not we need martial law right away.
Okay.
All right, man.
Listen, my battery's about to die, but thanks for inviting me into the chat. Yeah, because I don't want to cut off.
Dude,
you know,
the people love you. The people love Montana. Wild Hack says you can't argue with Peter's hair.
Thank you, guys. Thank you.
There you go. And Miss Daisy seems very relaxed. She's not too worried about things. She has a pretty good life. But all right, man. So you want to say goodbye, nerds, to everybody?
Bye, nerds. Keep it strong. Look at the muscles.
All right. Bye, nerds.
Bye, nerds.